Good morning, everybody. It's Dr. Pearlman. It looks like the microphone's coming in, and we'll get a better look at that over the course of this video. But I want to try to keep this one a little bit short. I know sometimes I have a tendency to ramble, and I actually am putting in this one, if you watch this video to the first few minutes, what you'll notice is what I'm going to do a cutaway and actually show you what to do and what not to do, these types of things when it comes to managing acute lower back pain. So I don't really make videos dedicated to this too much because I make more money, right? If somebody comes into the clinic and they have a specific condition to their back, I get to show them and guide them kind of through it, give them very specific exercises to them. But I do want to share a kind of an updated, generalized how to deal with your acute lower back pain, like what to do, what not to do. And what you'll notice is it'll be very straightforward, very simple. And the reason I want to make it like this is because there is a tendency to just sort of begin to stretch, right? People are like, oh, I didn't stretch enough. I pulled a muscle. I must have not stretched. I'm just telling you that's the way it is. I wouldn't even need to pull up a research paper to kind of convince you psychologically, if you will, that, how should we say, modern first world issues when it comes to exercise or sport and an injury comes to a thought of, right, or conceptualized by you, the person who's injured, or me, the person that's injured, me not anymore, but I used to. I pulled a muscle, right? I tweaked my hamstring, I strained my glute, I pulled my back, I strained a muscle in my back, I pulled a muscle in my back. And then the first thing to do is, oh, I didn't stretch enough, or I need to stretch more. So here's the deal. Every sprain-strain mechanism that happens in your body is, believe it or not, it's an overstretch injury. That's right. Whether it's the tiniest of ligaments or tendons in a joint space on whether it's the elbow or between the deltoid and bicep or in your spine, right? What I'm mostly concerned with in my office, or what most of the issues I treat in my office or care for in my office are ligament, tendon, sprain, strains, even if it was done by another chiropractor, or if it was done by your hairstylist or your boyfriend or your girlfriend, whoever's trying to crack your neck, or if you're actually just playing basketball and you land awkwardly and you sprain your ankle. Those are what we call open pack, overstretch injuries. Deal with it. So why on earth would trying to stretch that injury that is hyperstretched or stretched too far, why would stretching it make it better? And the answer is, it's complicated, but in the short, easy aspect of it, it doesn't, right? It doesn't make it better, especially not in the acute early phases of that injury. That's why we have this, acronym we used to use. I don't even know what they call for the ICE acronym. Elevate, rest, heat, whatever, right? I don't even know. Like, what's the acronym? EV, EHL. I don't know. But what I like to say is, acute ice, chronic heat. Because yes, in the acute phases of an injury, you better be able to find a way to sort of compress and passively care for that injury. Now, notice what I just said. If you compress, then it's not stretched. So you can, shrink, or you can reduce tension, or you have like the side that's, compress and the other side that's stretched. So compress. And then what you do is you passively just kind of deactivate that joint. Chiropractic is a good way to stimulate the joint in a passive compressive manner where it's almost reset, but make no mistake, you are hyperstretching it to some variable, like to some amount. A good chiropractor or a great practitioner of the spine or joint that is injured can actually feel, we call that palpation, or we can call that just sort of a palpatory feel that they intuitively have. Well, let's not make no bones about it. Good instincts as a practitioner is very important. There's no amount of evidence that can, quantify, so to speak, that, but certainly it can subjectively, person to person and patient to patient, so that kind of rapport that's being built and the trust between doctor-patient, or certainly a doctor with a good reputation in the world of manipulation, they can just simply say, like, he just knows where it is, she just knows where it is, right? My massage therapist, Adriana, is one of those people in the world of massage therapy that has that skill. I hope that people one day speak about me, Dr. Pearlman, and say, oh, he has that skill. I don't even, say that I do. Even if I would hint or suggest or think that I do, is irrelevant. What's relevant is that is how you can passively take something that's stretched, stretch it a little, but not too much, and sort of reset the joint. But in general, if you take a look at this video and you watch the moves, so say you hurt your back at the gym doing a deadlift or a squat in the last 48 hours, whatever, week, look at these two moves here. And when you're doing these two moves here, showing you right here, and then you don't do the other, bending, reaching one, that is how you get stable. That is how you give your spine that chance of rest. That's the acute protocol. That's ice, that's compression, that's rest, that's elevate. Even if there's no elevating being shown, it's not the point. The point is, it's the principles, because you're gonna only make any joint that you injure in the body better by doing a 4-phase, type of thing. And no, there's not a PDF to click and link below and subscribe, none of that nonsense. I don't do that shit. What I wanna tell you right now is there's 4 elements on how you heal any joint. Are you ready? I'm gonna show it to you. Number 1, okay? The number 1 thing you do, it's called passive motion. That's it. Passive motion. You could even say that motion's not passive. All right, okay. Passive motion, meaning like your chiropractor does it. You don't do, anything. You just lay there, whatever. Call it resting, right? Passive motion. That's number 1. Number 2 is passive progressive motion. So there it is. Number 2, passive progressive motion. It's in the words, the definition. I've just given you the definition of passive progressive motion. You passively begin to progress with motion through the range of motion in the injured joint. That's it. Then you go from the passive progressive motion to now active progressive motion. That's 3 out of the 4. Active progressive motion, where you yourself begin to do it progressively through active engagement. You're utilizing more muscle engagement. You're beginning to stimulate hold, right? Those things become a lot harder, right? Now that muscle that's been injured, that tear that we talked about has been injured, and it leaves one more element. And that final element is full compression motion. Now, even though that full compression motion to like active progressive motion, you could say like compression and motion to then full weight bearing compression and motion, almost as if it's a 5th element. But you get where I'm going with that, I hope, because that is how you kind of get to that space, and that's how you heal any joint. If you're not able to squat, if you're not able to lunge, if you're not able to deadlift, if you're not able to Romanian deadlift, if you're not able to do some element of like a pistol, if you're not able to get off the toilet without any help, if you can't bend, reach, and all the other things, full compressive motion active, then you're really never healed. And believe me, there is a lot of maintenance that goes into that. But those are the 4 phases of passive to active care and how you get stable and how you can help yourself out of any situation. All right, until next time, it's Dr. Pearlman. As promised, here are the exercises I recommend. Number 1 is just a passive, what we call prone position, laying on your stomach, very relaxed and prone. Breathe in through the diaphragm, through the floor, and just wiggle around and let your body relax. Don't try to be a hero, don't try to do too much bending, and do not go into a full cobra like you might see some YouTube channels promoting. If you can slowly walk up to all 4s, you do very mild cat-cow. Again, very mild. This is just a quick and dirty, and then butt back, head down for a child's pose. And again, avoid completely reaching, bending, stretching exercises during this time.